South Africa is just beginning to emerge from one of the harshest lockdowns in the world. But since restrictions were eased a few weeks ago, the number of COVID-19 cases has risen sharply. However, medical experts say the country still has a powerful weapon in its arsenal to combat the spread of the disease.
Community, the Department of Health is here. We are testing for coronavirus.
Instead of waiting for the virus to do its awful, inevitable work, South Africa has taken the fight against it right into poor communities in a bid to prevent it from completely overwhelming them. Already, more than 20 million people countrywide have been screened for COVID-19, with health workers often going door to door to test for symptoms.
The South African approach relies heavily on an army of community health workers like this one who work in small teams. But unlike other countries who had to hire thousands of people to do contact tracing and screening, these teams were already in place long before the global pandemic.
Turns out South Africa's past adversity has become its greatest advantage. At the height of the HIV epidemic, nearly 3 million people died in this country, and tuberculosis has claimed the lives of over 500,000 in the past decade. Now, teams of health workers armed with years of experience fighting these two national killers have been redeployed for this new battle. Like health worker Debora Patta,
have you been in contact with someone who has COVID-19?
No.
Who has a chilly start to her day screening commuters at this early morning roadblock.
Are you coughing?
No.
Sore throat?
Her work hasn't changed much. She spent over a decade tracking down patients with TB and HIV. Now she's using those skills to detect the coronavirus.
The only difference is that this one we have to be more conscious when it comes to health and protecting ourselves.
Think of Debora as a medical detective, hot on the trail of the virus, screening for symptoms, testing suspected cases, and tracing the contacts of those infected. This man tested positive. Now Debora must find everyone he came into contact with at the vegetable farming depot where he works. It's a tall order. Most of those workers have limited access to internet and cell phones. Fighting the coronavirus may not have been what Debora envisaged when she qualified as a community nurse, but the oath she took then still stands true today.
We pledge that we will be there for our community. Our first priority is saving the human life.
Medical experts never believed that South Africa could avoid being hit hard by the coronavirus, but they do say that its old battles against TB and HIV have prepared it for the fight that still lies ahead as the country approaches midwinter. Debora Patta, CBS News, Soweto, Johannesburg, South Africa.